So we have a continual reduction of errors over time, and we have public exposure in aviation. We have public exposure of errors and problems. And sometimes that's very embarrassing to the aviation industry and to the airlines, but I can go to, this is the National Transportation Safety Board site, and this is what I want to have happen in healthcare in the future. But I can go to this site, and I can look up, let's look up Boston, and let's see, we'll tell it it's Boston, Massachusetts, because there are a bunch of other Bostons around. Okay, and give me an airline to look up that flies out of Boston. Delta, okay. See, we can go into this database, it's a current database, and we can look up any city, any airport in the United States, and any airline, and look at all of their dirty laundry. Okay, let's see what happened here. And I don't think you can see this from back there, but I'll try to tell you about it. Let's see, the driver of a de-ice vehicle and a ground employee in the bucket of the de-ice vehicle were spraying the accident airplane. At the completion of the de-ice operation, the driver of the de-ice vehicle began to drive away from the airplane. The ground employee in the bucket of the de-ice vehicle then observed ice accumulation on the vertical stabilizer, that tall thing that goes up in an airplane. As the driver of the de-ice vehicle initiated a turn back toward the airplane, the boom of the de-ice vehicle struck the airplane, resulting in substantial damage to the left elevator. That's control surface in the airplane. See how detailed that is? Now, how would we like to see that kind? Just let me ask somebody else in here. Somebody, she's wearing her tag. Stephanie, would you like to see this on the Yale New Haven Hospital?
No.
No.
But I know it's coming.
It is, ladies and gentlemen, it is coming. It is coming, so that within a few years, you'll be able to do this. And what's the benefit of doing this? It's a benefit.
Driving down errors.
It does, that's the ultimate benefit, what Stephanie said, driving down errors. The public release of information has a direct relationship to the decrease in errors in an organization. As long as we keep it secret, and we were talking at Emory here how they share it with other people on their staff, as long as we keep it secret, nothing much is going to happen. We did a study of urologists in the United States, and we published information about all those urologists, but we put A, B, C, D. We didn't say what urologist it was. And we looked at their total costs, how much they were spending in surgery, the outcomes of the patients, and found out that after we did that study, the outliers came back in, and we had greater control over cost, greater control over safety, and greater satisfaction for both the urologists and their patients.